Can I ask a difficult question?
Yes.
Sometimes when doctors or nurses or other health professionals are talking to people about an illness, we try very hard to use the right language. We try very hard to say the right thing. And I hope that more often than not, we manage to get it right. But do you have any experience of people somehow saying the wrong thing completely by accident?
I was going for my annual mammogram. I think it was 3 years after my first diagnosis, and initially they bring you in for a physical exam before you go for the mammogram. And the doctor that did my physical felt something and said, "Oh, I feel a lump. This isn't good. Send her for a mammogram right away." And there and then I nearly fainted on the table. He wasn't. I didn't find him very empathetic. He wasn't looking at me. He didn't even look at my face. He was just looking at the lump. Spoke to the nurse. "This isn't good. Send her for this." And that was scary. Thankfully, it turned out to be nothing, but that stuck with me. I found that hard.
So you felt that you were a bit of flesh on a table,
Yeah,
and he was talking to somebody else about this specimen, please do something else.
exactly. Yes.
And he had great difficulty in looking at you and talking to you as a person.
He did, and he pushed and prodded, and it hurt. Now I started to cry, but it wasn't the pain; it was the fear when he was pushing, and he didn't acknowledge me as a person. He didn't ask me, "Was I okay?" The nurse came up to my side and caught my hand and squeezed my hand and looked at me, and I knew she was saying, "You'll be okay," but he didn't acknowledge me or my upset at all. There's one more thing I found this particular time when I went for my surgery. The following morning, when the consultant comes around with the junior doctors, I remember there was 5 of them, all males this particular day. They came into my room. I had my own room, and the consultant stood at the door, and the 5 of them literally gathered around the bed. Now I was still a bit out of it. I hadn't had a great sleep, and they came in and said with their chart, "Hello, Audrey, could we have a look at your wound, please?" Just like that. And firstly, no one pulled the curtain, and secondly, there was 5 of them. Now I was comfortable with my scar. I had seen it the night previous, but I know for a lot of people they can't look at it for weeks. They just can't face that physical side of it. It's upsetting. And I felt they didn't think about that, how this would be for me. There was 5, happened to be 5 males, which is a little more intimidating, standing around waiting for me to lift my gown so they could look at my scar. And it just wasn't very personal. And nobody asked my permission. "Would you mind?" It was, well, they did say, "Could you lift this and show me?" But I don't think they were thinking about how it would feel for me. I was vulnerable. I had just had surgery the day before, and it was a scar that was reminding me of everything that had happened and what was coming. And I felt that could have been dealt with better. The consultant did say, "Are you going to pull the curtain? Are you going to give her some privacy?" And I know they're training, but I certainly think the way they march into your room, you could be asleep there. It could just be a little more personal, I feel.
So when students or junior doctors examine you, you say that it could be more personal. If you were teaching them, and in a way this video is teaching them, what advice would you give them for the next patient that they see with that problem?
Firstly, I wouldn't come in the door and I'll stand around the bed looking down on top of you. I think to just come in, if one person sat down, said who they were, introduced themselves, asked you how you slept, how are you feeling today, how are things, and approached it just in a more kind manner. I felt on this particular day they were more concerned with what the consultant was, what they were being watched and they were being examined, they're in training, but they were more concerned with that than me in the bed.
That's interesting.